All right, so we're just flipping back around here. Our next presenter is Aida Fernandes. She'll provide an overview of the patient-oriented research that is underway called the Strategy for Patient-Oriented Research, aka SPOR. Aida is the Executive Director, as Dr. Moietti said, of the IMAGINE Network, a patient-oriented research initiative. Aida has over 15 years' experience in research administration and strategic partnerships in the health charitable sector. Aida was the Vice President of Research and Patient Programs at Crohn's and Colitis Canada, where she oversaw the organization's research, patient education, and advocacy programs for Canadian IBD community. Prior to her time at CCC, Aida worked with cystic fibrosis in several different capacities, including the Director of Medical, Scientific, and Community Programs. Aida holds a bachelor's degree in human biology from the University of Toronto and a master's of Business Administration in Nonprofit Management and Leadership from York University's School of Business. Please join me in welcoming Aida Fernandes.
Thank you, Penny, and good evening, everybody. And I hope you paid attention to my slides. You saw it all in backwards, so I'm not going to go through them again, which is great. So as Penny mentioned, I was prior to my role with the IMAGINE Network. I was with Crohn's and Colitis Canada, so I'm very happy to be here again in the capacity of really being an ambassador to the organization, what it does. So you've heard a little bit from Paul already about the IMAGINE Network. And what it stands for. It's got a very long name, so I would just like to keep to IMAGINE. But my focus will really be on what is patient-oriented research. So my goal today is to really give you a brief understanding of what we're talking about when we say patient-oriented research. Why is that important? Why might you care? And how you might want to get involved if that's of something of interest to you. We are obviously a very new network, and so we are hoping to get more and more patients not just excited about the IMAGINE Network, but also engaged and involved in a much more meaningful way. I also wanted to just quickly thank Sandra Zielinski. She's a patient representative on the IMAGINE Network, and she did provide me quite a bit of material for this presentation, so I just wanted to thank her in advance for that as well. So as I mentioned, the IMAGINE Network stands for Inflammation, Microbiome, and Alimentation, Gastrointestinal and Neuropsychiatric Effects Network, and obviously a scientist put that name together. But it does conveniently stand for IMAGINE, which is really what we're hoping to imagine here is some new and effective treatments for patients living with gastrointestinal disease. IMAGINE is one of 5 chronic disease networks that were awarded by the federal government. So there are other chronic disease networks out there, some in pain and diabetes, and so we're very excited to have really an area that tends to be underfunded and and understudied to receive such prominence. These networks were dedicated to what the government is calling strategy for patient-oriented research. Well, what do they mean by that? Well, the definition that the federal government, CIHR, has put together is that these networks are for patients, researchers, healthcare providers, and decision makers really to work together to build a sustainable, accessible, and equitable healthcare system and bring about positive change for Canadians. So that's quite an ambitious goal, and in many ways each network is doing very different things. Ours is very obviously focused on trying to look at new and effective treatments that could be very cost effective to the healthcare system for patients living with IBD and IBS and their associated mental health disorders. Okay, so what did we get out of that very long definition that the government provided on what is patient engagement? Well, we did some keywords. It's meaningful and active collaboration. It's research that's being carried out with and by members of the public rather than to or for or about members of the public. So it's not just research that's being done on patients, but really research that's being done with patients. And I'm going to give you a little bit more understanding of what that means. So it's really about patients being partners and not just subjects of research. What do we mean by the word patient partner, or even just the word patient itself? I mean, is that strictly the person that is affected by the disease? Well, it is people that have a lived experience, but it could be their family members, it's consumers of particular medical services, it could be their caregivers, it could even be a patient organization that's representing a broader community. So the definition itself of what we mean a patient partner is quite broad. Oops. Okay, I'm skipping ahead too fast. Let's try this way. There we go. There's some guiding principles, again, around patient engagement in research. It's really meant to be very inclusive. This is representing a diverse group of patient perspectives and bringing their ideas, their experience into the research. For example, I wanted to maybe I'll address it here just because we had a great example of a patient that, not related to our network, but this was actually an example out of the UK, where a patient had a very challenging heart problem. His aortic wall, his an artery to his heart was thinning, and he was an engineer, and he had had this congenital problem for some time, and the doctors had been tracking it for obviously his whole life to see how things were progressing. Got to a certain point where the doctors basically told the patient, well, listen, I think we're at the point we need to do a surgery to try to effectively manage this as possible. And he sort of scratched his head. He was a materials engineer by profession, and he just, having done a lot of research of his own medical problem, kind of felt, well, you know what, I think there's something else that could be done. And he actually worked closely with his doctor to develop a sleeve that would wrap around his aorta and prevent the thinning of the wall. And it provided that extra support that they needed. So this was obviously very, years of development, a bit of an extreme example on how patient engagement can be taken to the next level. But the real critical point there is that often bringing in patients with unique perspectives and appreciating and understanding their lived experience can really bring some interesting and innovative results to research and science. And so, I'm sure Paul was there and he heard this example too. I mean, this is something that's being now quite widely developed and used, certainly in Europe and UK, but worldwide now. So extreme innovation that's really derived from a collaboration between patients who aren't medical, researchers or scientists, but working closely with doctors to try solutions for problems. So another guiding principle guiding that supports patient engagement is around mutual respect. Obviously, in the example that I've given you, the researcher not just kind of yeah, sure, great idea, let's leave it at there, but really respecting his patient and his expertise and bringing that to the next level. So there is a role for, again, patients respecting the researchers and scientists. The researchers and scientists also respecting the experience and perspectives of the patients as well. Another guiding principle in this patient-oriented research is around co-building. And again, as we discussed, these are really true partnerships in that they're meaningful people working together from beginning to an end on solving a problem. So who's usually involved in this patient-oriented research? Well, obviously, patients, and again, that very broad definition of what it means to be a patient, the researchers. They're healthcare providers, they're doctor, nurses, other allied healthcare professionals. Policymakers and health system decision makers. As we mentioned, a big goal of the IMAGINE network is that, in fact, that there are improvements to the overall healthcare system. So to have that influence, we need to bring the decision makers and policymakers at the table to be engaged in those discussions. What are the roles for patients in research? So I did sort of give an extreme example where the patient was key in developing the innovative solution to the problem. But patients can be involved in many ways, whether it's just even identifying some problems. What are some of the key issues that affect you directly? Really understanding that and bringing that to the forefront is critical, because often, researchers and doctors might have an inkling as to what your major problems are, but they're not living with the disease the way you are, and you can really help identify and prioritize. No, you know what? This is in fact a much bigger issue for us than perhaps what you're studying in this area. They could help with designing, developing grant proposals, preparing the execution of the study, collecting data, analyzing and interpreting data. We have a number of patient representatives on our group, as I mentioned, Sandra Zielinski being one of them. They have actually undergone some specific training on how to do qualitative research, how to analyze those results. And so there are ways that it could be much more involved and engaged in helping answer particular research questions. Certainly around disseminating the research, that's obviously the word of mouth of using your own social networks to get people excited and engaged in the research is important. Implementation and perhaps monitoring and evaluation. So really from beginning to end, there are potential roles for patient involvement. This is a little bit more of a framework for understanding the different levels of participation. I'm not going to go too much into this. In fact, it's sort of organized a little bit differently here. But just to say that, that there's different levels and intensity of participation in research, all the way from just being informed, you're consulting on research, you're a little bit more involved in research, you're actually formally collaborating, and you're really being empowered to make decisions. So it really, again, there's from a much more informal, more passive type of role to a much more involved role in research. And that, again, could change whether it's at an individual level, at the organization level, or at a broader system level. Oh, it's missing the title here, but that's okay. So the key point I wanted to get across here is really, well, how can you get involved in the IMAGINE network? Well, first of all, I'd like to recommend that you visit our website. You can visit imaginespor.com. You'll learn a lot more of what Dr. Moietti has mentioned today, but we'll continue to update that website with progress as we continue to move forward. So that's, again, a way that you can stay informed of the research that's going on. On a more regular basis, if you choose to follow us, we do have Twitter and Facebook accounts, so you can stay a little bit more apprised of what's going on. If you'd like to even see yourself playing a stronger role, you could help share the word of what's of the different projects with your own community and your own social networks. We are also looking for people to serve as patient representatives. There's different scientific working groups where we really seek the advice and input of patient representatives. And there's a number of governance committees as well, where you're really, again, having a much stronger role in oversight over the projects as they move forward and giving guidance and advice there as well. We do hold a number of training sessions. In fact, there is an open training session that's coming up in June. That's Saturday, June 3rd. It will be in the Toronto area near the Pearson Airport. So if people are interested in just even having a training session, a little bit more thorough of, well, how do I actually do patient-oriented research? How might that tie in with the IMAGINE network? You're most welcome to attend that pre-session, and there'll be more information on that on our website if you are interested in attending. And obviously you can participate as a subject in one of the many research projects that are coming out of the IMAGINE network. So we certainly welcome your ideas. If people are interested, you could, again, reach out to me through the IMAGINE SPOR website. My contact information is there, and I'd be happy to discuss opportunities with you further. Thank you.